I am a communications consultant and a writer. I'm married to a family physician. We have 3 grown children and 2 baby grandkids. Our lives are very rich, very busy, very fulfilled, and sometimes very frantic.
Coagulation is a basic function of blood flow that requires tissues to receive oxygen and nutrients to stay alive, essentially. It has to be kept at a certain level, otherwise clotting can occur, which would interrupt the blood flow and cause damage to certain organs or could actually be fatal.
In May of 2011, I had aortic valve surgery, and I chose to have a titanium valve, which meant that I would be on blood thinners for the rest of my life.
The conditions that would require anticoagulant medication are atrial fibrillation, a heart condition that can lead to strokes, people with mechanical heart valves, and people with blood clots in their legs or lungs.
I've been monitoring my INR since May of 2011.
INR, first of all, stands for International Normalized Ratio, and it's a standardization of clotting test that's been around for decades. Studies have shown that the INR should be in a certain range. If it's too low, you could have a reoccurrence of the blood clot condition, or if it's excessive, too high, it can lead to an elevated risk of bleeding.
In the first weeks from getting out of the hospital, I would go to my doctor's clinic in Toronto twice a week to have my INR taken.
Traditionally, patients went to a lab for their INR. The results were then recorded, faxed, phoned to whoever ordered it, often a family doctor, and then they would call the patient often the next day.
In my personal life, I like to travel a lot. I travel a lot on business. My wife and I go on long vacations to the ends of the earth, and there are often not fabulous blood drawing clinics at the ends of the earth.
Now we have a point of care machine that does almost an instantaneous INR test result.
I first found out about self-testing when I went to the hospital for my 3-month checkup after my heart surgery, and someone there, sensing my anxiety around having to go to the lab twice a week, suggested self-testing. I'd never heard of self-testing.
Many clinics, especially anticoagulation clinics, use that, and patients can also be taught to use the machine and monitor their own blood.
Every 9 or 10 days, I open my kit, I draw a drop of blood from my finger, and within 10 seconds, a number turns up, and I know what my INR is.
So the self-testing method is as accurate as doing the old-fashioned method of going to a lab and having the standard venipuncture in your arm.
So much more convenient and less anxiety driving to do that. The only drawback I can see is that for some people it might be cost prohibitive.
Training on the INR device can be obtained in anticoagulation clinics. Certain pharmacies are certified to do training, or the patient can go online and learn how to use the machine. It is just a small finger prick, and the results are as reliable as the standard INR test that's done in the lab.
I found out about self-testing from someone at the hospital, and she happened to have a kit there, and she demonstrated what turned out to be incredibly easy process. Who would I recommend to do self-testing? Certainly people like myself who are very busy doing other things and where time is incredibly important, but also people who live or work far from a family doctor or a lab or a place where they can get tested.
So I think having a patient engaged gives them better control of their condition, and they're more likely to keep up to date on information about their condition that would be useful to them.
I think we all need to inform ourselves, we all need to do our own research, and we all need to ask our doctors about monitoring and the options around it, because there are options.
To see more information about point-of-care or at-home self-testing for INR, visit coagucheck.ca.